Welcome. I'm Diane Kovanda, and this is Yoga Talk. And with me today is C.Patricia MD. She's a family physician. And I wanted to talk to you today about how yoga integrates with living a healthy lifestyle and medicine. Can you talk a little bit about that?
I'd be happy to. As we are learning more and more about yoga, and the science behind the research is getting stronger and stronger, we're able, with much more valid research behind it, to discuss the benefits of yoga. As a Western medicine trained physician, my approach has got to come from that basis, but I've always asked of people to trust their own wisdom about their own bodies, and I think anyone that has practiced yoga can say without reservation how good it makes them feel. And now we have the science to back that up. Part of a healthy lifestyle has got to be movement. It's definitely foundational to living a healthy life and having your body be optimal. Nutrition, hydration, good sleep, and movement. And yoga, as part of that, because of the depth of the practice, can be so profound, the health benefits can be equally profound. And what we're finding is that beyond our comprehension of cardiovascular effect, yoga does more than we can account for. Beyond what seems apparent musculoskeletally, yoga does more than we can account for.
Well, when you're practicing, you're usually in a traditional yoga class, you're doing some breathing practices, mindfulness, meditation, and all this movement, which is stretching, strengthening, creating flexibility. So there's a lot of components to yoga.
And the involvement of intention seems to be more and more recognized as important in that. So the people who are at the gym mindlessly moving, mindlessly working out, aren't receiving as much benefit as they might, it seems, by research, as well as by what we know in our own body's wisdom, as much benefit as someone who is being mindful of the movement, mindful of the practice of the musculature moving, the skeletal flexibility, and the cardiovascular effect of what's going on. And you use the word traditional. I just want to say that yoga, which has been around for thousands of years, is indeed a tradition, a traditional practice. What I do is kind of recent development. Is not traditional. It's conventional modern medicine, but I don't call what I do traditional medicine. Traditional medicine is Ayurvedic, traditional Chinese medicine, Native American medicine. Those are traditions. What I do, sort of scientifically based modern medicine, is a fairly modern development.
It's a newcomer.
It really is. And what I find amusing is that there's a lot of focus these days in research, in scientific research, using modern methods, placebo-controlled, double-blind, peer-reviewed, prospective studies to study these traditions. And the more we do that, the more we are sort of basing our knowledge base about how effective they are, when it's been known for thousands of years by people who've had to trust their own wisdom and just observe the results. So it's a really special time, I think, right now when this sort of research is going on.
The newcomers catching up
to
some wonderful practices that people have done for thousands of years, they knew innately they were good for them, and that's your own inner wisdom speaking to you. Yeah, when I take a great big deep breath as low as I can go and stretch my arms up here, that makes me feel good. And now there's research behind it that says, yes, that makes you feel good.
And able to measure the parts that are being affected.
Right.
It's really phenomenal time. It's a really phenomenal time. It's a perfect blossoming of that.
There's so many different styles of yoga being offered, especially in the States, from the slowest restorative to really power, intensity that gets your heart rate up. And then everything in between, there's gentle yoga, there's moderate yoga, there's different people have given their names to different styles. And do you have a preference? Do you think there's a type of yoga that might be better for some people than others?
This is going to go back to trusting your own wisdom about your body, knowing your body's limitations, knowing what you like. If you don't like sweating, you shouldn't pursue a hot yoga. If you are easily distracted, you shouldn't pursue the yin or very slow moving yogas, because you know you're not going to be content in that format. So the tradition of what you're doing is the right thing, coupled with an instructor or a type of yoga that suits your physical needs and mental capacity, is the perfect combination. But it takes a little bit of looking into. So you can't just jump in any yoga class and expect that it's going to necessarily be the right one for you, although any class can be modified to work for you if you are experienced enough and know how to work it. But there, again, the different types allow for each of us to pursue a venue and a practice that's going to suit us best.
I know you bring into your practice I just know from personal experience with you as a patient, you've had me breathe when I've become anxious in your office over the simplest thing like having my blood drawn. And you use these methods that are age-old that are so simple. You'll calm somebody down. I've never encountered a doctor like you, actually. Can you say a little bit about what might be helpful to somebody if they are experiencing anxiety?
The physical manifestation of anxiety, which can be brought on by a fearful situation such as having your blood drawn, or can be a chemical imbalance that is the same as depression, just with a different manifestation, can be countered with physical remedies. Not always successfully, completely, but certainly to some degree. And this is a skill set which can be practiced so that it can be much more easily done, like sit-ups and push-ups. And I describe this to patients all the time. If you've never done a sit-up before and you try to do one, it's going to seem impossible. You might be able to do 3, but with a little bit of practice, your body knows how to do that. And the same thing comes with calming, with a mindful breath, to get outside of your head and into your body in a way that's going to release all those good chemicals that we produce, but we don't often bring to bear. The better you get at it, the more practiced you are, the more easily accessible those feel-good endorphin type chemicals are, and the more easily you can achieve a state of more calm, not necessarily thoroughly calm, but more calm. Takes practice.
Yeah.
But it's completely, everybody has that tool in the toolbox. It may be quite buried, and you might need to dig it out, and you might need to sharpen it up, but it's there.
So yoga tools are pretty natural, and
absolutely,
they come to us, they might be taught to us, but then it's almost like we're waking up something innate in us that's natural.
100%. The American culture does not respect our own body's wisdom. We want the doctor with the piece of paper to tell us what's wrong with us rather than to experience it. And then we want to be told what to put into us to fix it rather than to rely on the unbelievably amazing, incomprehensibly complex and effective system of healing that our bodies have. So what a relaxation technique does is get you back in touch a little bit with that part of your body that is naturally healing.
It makes a lot of sense.
It's strong medicine.
It is strong medicine.
Very strong medicine, what we have between our ears.
And I love that you use both medicines, right? Some of the ancient stuff that seems to have been proven and works and is being researched now, and all of the new medicine that is being discovered every day.
Yep, and the the individuality for the applications is really important, and that's where the concept of a therapeutic relationship with your practitioner comes in, because there's a certain amount of what they call buy-in, or it has been labeled placebo effect, that can be extremely important in any kind of healing that you're seeking. So healing and curing are not necessarily the same thing. Something can be cured, but you're not healed from the experience.
Oh, interesting.
Yeah, but they certainly can coincide and help one another.
That's great. Thank you. Thanks for coming on today.
You're very welcome. It's a pleasure.